So today we'll take up one more important topic, that is the cardiovascular system. So we'll try to briefly understand what exactly is the cardiovascular system. So as you know, the name itself indicates cardiovascular. So this cardiovascular system will deal with the cardio, that is the heart, and vascular means vessels. Cardio means heart and the vascular means vessel. So this system will be mainly related to the heart as well as the vessels which are related to it. So the cardiovascular system is divided for descriptive purposes into two main parts, the circulatory system and the lymphatic system. So today in this class we will study about the circulatory system, and in the future class we will discuss about the lymphatic system. So the just to understand what exactly is the difference between these two, the circulatory system, as I said, consists of the heart, which acts as the pump, and the blood vessels. Vascular system includes blood vessels, that is the arteries and veins, and also sometimes it is also includes the lymphatics. And some exclude it, and only they say that the arteries and veins are the blood vessels, and the lymphatic system is a totally separate channel. Okay. Anyhow, it is actually a part of the cardiovascular system, which you will see when we study the lymphatic system itself. So right now, as you know, the circulatory system consists of the heart, which acts as the pump, as well as the blood vessels through which the blood will circulate. So the heart acts as the pump, and the blood vessels through which the blood will be flowing. So this is called as the circulatory system. The lymphatic system consists of lymph nodes, lymph vessels through which the colorless lymph flow. So a small quantity of the blood will flow out of the blood vessels as the tissue fluid, and it will not return back through the venous system, but through a separate channel that is called as the lymphatic system. When we study this lymphatic system, then you will understand it is part of the cardiovascular system, because the fluid which is passing through, it is not blood, it is colorless lymph flows. Okay, this colorless lymph is nothing but the tissue fluid, which is from actually the plasma fluid coming from the the blood itself. Okay, so which will pass through a separate channel called as the lymphatic system. So this circulatory system includes the heart and the blood vessels, which we'll study in this class. So the heart, as you know, is a very important organ. It is a hollow muscular organ which acts as the pump for the blood and pushing the blood to all the parts of the body. The weight of the heart is almost 300 to 350 grams. It is slightly higher in case of male compared to the female. In males it will be almost 350 grams, and in females it will be around 300 grams. Okay, the size of this heart will be almost the size of a fist. Fist is when you clench your hand, that is called as the fist. So that is the size of your hand. If you clench your fingers within your hand and make a fist, that is the size of your heart. Okay, so this heart will have four chambers. We will see there are four chambers, and this heart, the position of this heart is within the chest. Okay, between the lungs. So it will be between the lungs, within the chest. Okay, surrounded by membrane called as the pericardium. The heart has a covering called as the pericardium. Again, the pericardium has two components, the fibrous pericardium as well as the serous pericardium. Then there is pericardial space is fluid filled to nourish and protect the heart. There is a small quantity of space which is called as the pericardial space. Okay, it is filled with fluid which is part of the serous pericardium, where there will be small quantity of fluid, and which will help in the nourishment as well as the protection of the heart both. So if you see here, this is the chest wall. If you can see here, these are the rib, and in between is the space filled with muscle. These are the intercostal muscles. Okay, these are the ribs, and behind these are the vertebrae. And if you see here within the chest, you can see the heart. So here also there is a diaphragm. So this is the diaphragm which we studied in the last class. So just above the diaphragm, on the diaphragm is the heart, which is sitting almost at the center, slightly deviated towards the left, and on either side we have the lungs. So this is all the components within the chest. So the position of the heart lies in the thoracic cavity behind the sternum. It lies within the thoracic cavity. As you know, this is the cavity within the thorax behind the sternum. Sternum will be in the front, as you know. So just behind the sternum will be the heart. Between the lungs, so it is between the two lungs, right and left lung. Between them, almost at the center is the heart, and on the diaphragm. Diaphragm is below, over which heart is sitting. So it is on the diaphragm. So this is the position of the heart. So it is within the chest cavity, behind the sternum and the ribs, and between the two lungs and above the diaphragm. That is the position of the heart. Now if we go cut and see inside the heart, then we can see the interior of the heart. Interior means inside of the heart. So when we study the interior of the heart, heart is divided into right and left side by the septum. If you see here, okay. So the heart is divided into two parts by in a septum. This is called as the septum. So there is interatrial septum between the two atria and the interventricular septum between the two ventricles. So this middle part is called as the septum. This part is called as right heart. This is the left heart. So between the heart is divided into right and left side by the septum. This is the septum in the center. Each side is divided by an atrioventricular valve into an upper chamber, the atrium, and the lower chamber, the ventricle. So if you see here, this is the atrioventricular valve on the left side. Similarly, there will be a valve on the right side also, which is not shown here. So you can imagine here also there will be a valve, similar valve on the right side and left side, both the sides. So this atrioventricular valve will divide again the whole of the left and right chamber into above part, upper chamber is called as the atrium, and the lower chamber called as the ventricle. So this is the left atrium, left ventricle. On the right side, similarly, there will be right atrium and the right ventricle. Okay, so there will be four chambers. It will be divided by the septum into right and left. Then the atrioventricular valve will divide it into upper and lower chambers each. Okay, so there is right atrium, right ventricle, left atrium, left ventricle. These are the four chambers of the heart. Here you can see here. So this is the right atrium, this is the right ventricle, this is the left atrium and the left ventricle. This is the septum in between. So here also you can see here, this is the right side, this is the left side of the heart. Again it is divided into upper atrium, lower ventricle. Here also atrium, ventricle, four chambers within the heart. So the chambers of the heart, when we study the chamber, the first and the most important will be the right atrium, because this is the chamber where all the blood, venous blood, if you see here it is shown in blue color, because all the deoxygenated blood or the impure blood will come to the right atrium from through these veins. So the right atrium is thinner wall than the ventricle. It is thin wall compared to the ventricle. If you see here, it is thicker compared to the thin wall of the atrium. Receives deoxygenated blood or the impure blood. Okay, so deoxygenated blood or the impure blood from the body through the superior and inferior vena cava. If you see here, this is the superior vena cava. This is the inferior vena. Superior vena cava will bring all the blood from the head and neck as well as the upper limbs, and the inferior vena cava will bring all the impure blood from the lower limbs as well as the abdomen. Okay, so these two are the main veins which will drain the blood into the heart. Deoxygenated blood, impure blood. Okay, the blood pumps the pumps, this atrium will be pumps the blood through the tricuspid valve into the right ventricle. From here, when the right atrium pumps the blood, it will push the blood into the right ventricle. From the right atrium, it will go into the right ventricle. So the right ventricle is thicker wall. If compared to the right atrium, the right ventricle is thicker than the atrium. Comprises most of the anterior surface of the heart. If you see the anterior surface of the heart, it is mainly made up of the, so if you see here this part, right, if you see here, so this whole thing is made up of the right. Here is the right atrium, this part is the right ventricle. So the anterior surface is mainly formed by the right ventricle. Circulates deoxygenated blood to the lungs through the pulmonary valve into the pulmonary trunk. If you see here, the blood has come from the, if you see same thing, it has come to the right ventricle. So from the right atrium to the superior and inferior vena cava into the right ventricle. From here, it will be pushed into the pulmonary trunk. This is called as the pulmonary trunk, which will divide into pulmonary right and left pulmonary arteries. So if you see here, the pulmonary trunk divides into right and left. It will push the blood into the lungs for the oxygenation. So now this impure blood goes and get oxygen from the lungs. Okay. So circulates deoxygenated blood to the lungs through the pulmonary valve. There is a valve here. This is called as the pulmonary valve, which will be guarding the pulmonary trunk. Here, between the right atrium and the ventricle, there is the atrioventricular valve. Atrium and ventricle. So it is called an atrioventricular valve. Okay. Now here near the pulmonary trunk is the pulmonary valve. Okay. Now this blood has gone to the lungs, gets oxygenated. Now it comes back to the heart through the pulmonary veins. Pulmonary veins back into the left atrium. To the left atrium. So the left atrium receives freshly oxygenated blood from the lungs through the 4 pulmonary veins, 2 from the each lung. So 2 from the right lung, 2 from the left lung will push the blood, oxygenated blood, pure blood back into the heart, into the left atrium. So the left atrium is used the blood from the 2 veins on the right side, 2 veins on the left side. These are called as pulmonary veins, 4 veins. Now this pumps the blood to the left ventricle through the mitral valve. Now from here, right, the left atrium, the blood is pumped into the left ventricle through a valve here. This is called as the mitral valve or the atrioventricular valve on the right side, which is also called as the mitral valve. So now the blood has been pumped into the left ventricle, and now this receives oxygenated blood from the left atrium. So as you know, the left atrium has the pure blood. Now it is pumped into the left ventricle. Now if you see the wall of the left ventricle, this is the thickest myocardial wall. So this wall is the thickest. We said the atrium is thin wall and the right ventricle is thicker wall. But compared to the left ventricle, compared to the right and left ventricle, the left ventricle has almost 3 times thicker wall compared to the right ventricle. Why it is so? Because now the blood has to be pumped from here into the aorta and from there to all the parts of the body. So this has to be very strong. So the blood will now be pumped from the left ventricle into the aorta. So it needs a lot of energy. So that's why the wall, the left ventricle has a the thickest myocardial wall. Myocardium means the muscle of the heart. That is called a myocardium. So the thickest myocardium will be here in the left ventricle wall. Now it pumps the oxygenated blood to the systemic circulation via the aorta. Now it will push the blood into the aorta and from there to for systemic circulation, passing through all the parts of the body, to the head and neck, brain, the upper limbs, lower limbs, abdomen, thorax, everywhere it will be supplying through the aorta. So that's why it needs a lot of energy to push the blood to all the parts of the body. Now, if we study the histological structure of the heart wall, So the wall is here as we saw. Okay. So this is the thick wall here. This is the thinner wall. This is the thinnest wall. The atria have thinner wall compared to the ventricles. Now comparing the right and left ventricle, the left ventricle has the thickest wall. So how this wall is made up of? Okay. So now we'll study that structure of the heart wall. Wall. That is, this is the wall. Okay. This is the wall. This is the wall. This is the wall. So how it is made up of? What is it made up of? The heart wall is composed of three layers of tissue form the surface and inward. Okay, so it has three layers. So what are those layers within this wall? So within this wall, what are the three layers? From outside to inside, it is the pericardium, myocardium, and endocardium. Outside we have the pericardium, then we have the myocardium, and the innermost will be the endocardium. If you will study here, this is the pericardium outside, between the red colored or the pinkish color, that is the myocardium, and the innermost will be the endocardium. So if you study here, this is the pericardium, covering called as the pericardium, and this is the myocardium. Myocardium, muscle wall. Myo means muscle, cardium means heart. The muscle heart, it is specialized as we have studied before. This is a special muscle which is lining the wall. So this is the myocardium. Then the innermost, this is lining inside the cavity. This is called as endocardium. Endo means inside. Cardium is the heart. Inside the heart, the lining is by the endocardium. Peri means outside. So peri means outside. So it is covering outside heart. Myocardium is the muscle of the heart in between, and the innermost will be the endocardium. Here also endocardium will be here. Pericardium will be outside. Okay. So there are three layers of the heart wall. This is the pericardium, then the myocardium, and endocardium. Now, if you study the pericardium itself, as I said before, pericardium is divided into two parts. One is outer, which is called as the fibrous pericardium, and inner is the serous pericardium. Outside, this is the pericardium. It has two layers. Outer we have the fibrous pericardium outside this whitish layer, and inside we have the serous pericardium. Serous pericardium, this whole thing. Okay, which has two components. We'll see. First, we'll see there are two layers. Outer is the fibrous, inner is the serous pericardium. The pericardium is made up of two sacs. Outer sac is called as the fibrous pericardium. Outermost, this is the fibrous pericardium outside, and is made up of the fibrous tissue. That's why it is called as fibrous pericardium, made up of the fibrous tissue. Now the inner is called as the serous pericardium. Inside we have the second layer, that is called as the serous pericardium. Okay, which will have two components. The serous pericardium is made up of two layers, the parietal layer and the visceral layer. If you see here now, so the outer of this is the whole of the both the layers are called as the serous pericardium, which has an outer layer called as the parietal pericardium, and inner, which is totally attached to the heart, that is called as the visceral pericardium. Viscera means the organ. So whatever layer is attached to the heart, that is called as viscerum, and outside, that is called as the parietal. In between there is space, that is called as the pericardial space, filled with pericardial fluid. Okay, so innermost is the visceral layer, outer is the parietal layer of the serous pericardium. In between is the space called as the pericardial space, filled with pericardial fluid. So now if you see here, going back to this picture, pericardium is the fibrous layer. Okay, so it has, if you see here, the pericardium has two layers, fibrous and serous. This is the fibrous layer, and serous has two layers, the parietal layer outside and visceral layer, which is attached to the heart, which is called a visceral layer. And in between there is the pericardial space, filled with pericardial fluid. Okay, this is how it is arranged actually. Okay, outermost fibrous pericardium, inner there are two layers, parietal and visceral layer, and in between there is pericardial fluid. So the serous pericardium is made up of two layers. The outer layer is called as the parietal pericardium, this one, and the inner layer is called as the visceral pericardium. This is the inner layer, okay, which is continuous with the parietal pericardium and is adherent to the heart muscle. If you see the visceral layer, it is totally attached to the heart muscle, so it cannot be separated from the heart muscle. Totally attached to that. Okay. Now coming to the serous membrane consists of the flattened epithelial cells. This serous membrane is made up of epithelial cells. It secretes serous fluid into the space. So these the parietal and visceral layer, this uh, membrane has epithelial cells inside, and these will be secreting serous fluid, and it will flow into the space, and is called as the serous fluid. It secretes serous fluid. The serous membrane consists of flattened epithelial cells. It secretes serous fluid into the space between the visceral and parietal pericardium, between the visceral and the parietal pericardium, okay, which allows smooth movement between when the heart beats. So when the heart is beating, these two layers don't touch because there is fluid, and it allows free movement of the heart whenever the heart beats. So it reduces friction between these two layers, so that the heart can beat easily. That is the function of the serous pericardium. Serous pericardium, as I said, has two layers, the visceral layer and the parietal layer. Fibrous layer is only one layer. So fibrous and serous together, they are called as the pericardium. Now coming to the muscle layer, that is the myocardium. Myocardium, as we already seen, it is a specialized muscle which is seen only in the heart. That's what it's called as myocardium, the muscle of the heart. It is the middle layer made up of the cardiac muscle. Cardiac muscle, that is a special muscle. It is involuntary, as we already seen. Heart cannot be, we cannot control the heart beating, so it is called as involuntary. Whatever we control, that is called as voluntary. So because we cannot control the heart, so it is called as involuntary. Then it branches. If you see the muscle fibers, muscle cells, they branch. If you see here, there is branching. Here, if you see here, is branching. So usually cells don't branch, but the cardiac muscle, they branch, and they have one or two nuclei. Usually they will have one. Sometimes they can also have two nuclei because they will branch to the other side. So now these two cells are called as one, and they look like two nuclei. Form the bulk of the heart wall, thickest layer. So as we have seen, the thickest layer in the heart wall is the myocardium. So this whole thing is made up of these myocardial cells, that is the cardiac muscle. Then the innermost will be the endocardium. If you see here, this is the innermost layer, as we have seen, innermost. Okay, here you will be the innermost, inside lining is done by the endocardium. Inner lining, smooth surface that permits blood to move easily through the heart without agglutination, means without clotting. Okay, so it prevents clotting. So inside it is lined by the endocardium, which allows the blood to freely move without clotting. Okay, so that is what it means. Now coming to the cardiac valves, the cardiac valves. What are these valves? Okay, so the cardiac valves. Okay. So the cardiac valves. Okay, so they are atrioventricular valves. As we already seen, between the atrium and the ventricle, there are valves. Okay, if you cut this heart like this, if you see from above, this is how it looks like. Okay, so the right side, it has three cusps, one, two, and three. Three cusps, tricuspid, and the left side it has only two cusps. So this is called as bicuspid. Okay, we'll see that. So the valves prevent backflow. What is the function of these valves? They allow only one direction force. If the blood wants to go back, it cannot. So it prevents backflow. It prevents black backflow of the blood and allows flow of blood in one direction. It allows only unidirectional flow of the blood. Atrioventricular valves. Okay, there are two on the left and the right. The left valve, AV valve, this is atrioventricular left valve, is also called as, the other name is mitral valve. This is clinically very important because clinically it creates lot of problems like mitral stenosis, mitral regurgitation, and all those things. Okay, so mitral valve, this mitral valve, or it is also called a bicuspid because it has only two cusps, contain two cusps, separate the left atrium from the left ventricle. If you see here, the left atrium is separated from the left ventricle through this left atrioventricular valve. Now coming to the right valve, this is the right atrioventricular valve, which is also called as the tricuspid. Why? Because it contains three cusps. If you see here now, so this is the same valve, 1, 2, and 3. Okay, so there are three cusps. That's what is called as the tricuspid valve. Separate the right atrium from the right ventricle. If you see here, it is this valve is separating the right atrium from the right ventricle. What is the function of these valves? They prevent backflow, so they allow only one directional flow of blood. Now coming to the other valves, apart from these right and left atrioventricular valves, there are other valves like we saw already one, that is the pulmonary valve, which is present here near the pulmonary trunk, and the second valve is present near the opening of the aorta. So here that is called as the aortic valve. So there are additionally two valves, the pulmonary valve and the aortic valve. So the pulmonary valve as well as the aortic valve. These are called as semilunar valves. Okay, these are the guard the pulmonary artery and prevent backflow of blood to the right ventricle. So these pulmonary valve will again does the same function. It prevents backflow from the pulmonary trunk and back into the right ventricle. So it prevents the blood from flowing back to the right ventricle. Similar, the aortic valve, which is present near the opening of the aorta, what does it do? It guards the aorta and prevents backflow of the blood to the left ventricle. Similarly, so the blood which is pumped into the aorta, so backflow is prevented by this aortic valve. So all valves usually the main function is the prevention of backflow, means allowing only one direction of flow. Reverse flow is not allowed. Okay, so here you can see this is the pulmonary valve, this is the aortic valve, this is the tricuspid valve, and this is the bicuspid or mitral valve. Okay, so all these four valves can be seen. So these two are called as the atrioventricular valve, right and left, and this is called as pulmonary, and this is called as the aortic valve. So this is how they look like. If you see here, this is the tricuspid valve, three cusps, bicuspid valve with two cusps, and these are the aortic and pulmonary valves with three semilunar valves. Now coming to the circulation of the blood, there are three types of circulations which we should know. Okay, one is the systemic circulation. As we saw, the blood from the right ventricle, the left ventricle is pumped into the aorta, and from there it flows to all the parts of the body. So that is called a systemic circulation. Okay, okay. So there are three types of circulation. The first one is called a systemic circulation. It begins in the left ventricle, as we saw. It begins in the left ventricle, where the oxygenated blood passes through the aorta and it branches to reach all the tissues of the body. Okay, so it is pushed into the aorta, and from there into the, as I said, it goes to head and neck, it goes to the upper limb, it goes to thorax, abdomen, lower limb, everywhere from here. Okay, so the blood is begins in the left ventricle, where the oxygen blood passes through the aorta and branches to reach all the tissues of the body, where exchange of gases and material occurs. So exchange of gases, exchange of oxygen, carbon dioxide, as well as nutrition. Materials mean nutrition. Okay, that is the providing of the important nutrition, vitamins, everything. Then the deoxygenated blood is collected by the small veins, then by the large veins, and finally reaches the superior and inferior vena cava into the right atrium. So all the blood will go to different parts of the body, to the aorta, from the aorta to different parts of the body, get they supply the oxygen, and the venous blood will return back through the superior and inferior vena cava. superior vena cava from the upper part of the body, and inferior vena cava from the inferior vena cava from the lower part of the body, back into the right atrium. Okay. So the deoxygenated blood is collected by these small veins and then by the large veins, and finally through the superior and inferior vena cava into the right atrium. The blood passes from the right atrium to the ventricle where the circulation ends and a new cycle starts. So this blood which is coming back to the right atrium will flow into the right ventricle. This is called as from the left ventricle into the aorta and to different parts of the body, back into the heart to the right atrium and right ventricle. This is called as the systemic circulation. Systemic means all the parts of the body, to all the systems of the body. As you know, the systems, there are different types of systems. Cardiovascular system is one, gastrointestinal, respiratory, endocrine, we have studied already. Okay, so this is called as systemic circulation. The second type of circulation is called as pulmonary circulation. Pulmonary means lung. The other name for lung is pulmonary. Okay, it starts on the right ventricle where the venous blood passes through the pulmonary trunk and reaches the lung. If you see here, so the blood which is coming from the right atrium to the ventricle, now it is pumped through the pulmonary trunk and through the pulmonary arteries into the other the lungs, where this impure blood, deoxygenated blood, will get oxygen and it becomes pure and flows back from the lung into the heart, into the left atrium. So this is called as the pulmonary circulation. Pulmonary circulation, it starts from the right ventricle. So here is the right ventricle to the pulmonary trunk. Okay, where the venous blood passes through the pulmonary trunk and its reaches the two lungs. Okay, both the lungs where exchange of gases takes place. So it will remove the carbon dioxide in the lungs and add oxygen. The oxygenated blood returns to the left atrium. So the blood will come back from the lungs back into the left atrium and from there into the left ventricle. Okay. The oxygenated blood returns to the left atrium via the four pulmonary veins and then to the left ventricle where a new cycle occurs. So it will come through the four veins, four pulmonary veins back into the left atrium into the left ventricle. This is called as from the right atrium into the pulmonary trunk and to the lungs for oxygenation and back into the heart. This is called as pulmonary circulation because it is going to the lungs. In the first case, it was going to different systems, so it is called a systemic circulation. In the second, it is going to the lungs where it get oxygenated, and that's why it is called as pulmonary circulation. Then the third type of circulation is present in the body, that is called as portal circulation. Portal circulation. It is a type of circulation which is interposed between the capillary beds. This is slightly difficult for you. At least you should know these two: systemic circulation and the pulmonary circulation. This is the third type called as portal circulation. It is a type of circulation which is interposed between the two capillary beds. Okay. The venous blood from the stomach, spleen, pancreas, and intestine is collected into the portal vein. So the blood flowing through the portal vein, that is called as the portal vein, which enters the liver and divides into many branches, which end in the liver sinusoids. The blood leaves the liver sinusoid by the hepatic veins, which end in the inferior vena cava to the right atrium. So the blood will start from the portal, from different organs into the portal circulation to the liver and back into the inferior vena cava. So this is called as portal circulation. Okay. Now going to the cardiac cycle, how exactly what exactly the cardiac cycle and how the heart beats. Okay. So as we know, the heart acts as a pump and its action consists of a series of known events cardiac called as the cardiac cycle. Cardiac cycle. Whenever the heart beats, it leads to a cycle called as cardiac cycle. So what exactly is the cardiac cycle? During each cardiac cycle, the heart contracts and then relaxes. That is called as the systole and diastole. It is also called as lub-dub. In general language, in the layman's language, it is called as lub-dub. But you should know This is called as the systolic and diastolic. Systolic is contraction of the heart, diastole is the relaxation of the heart. Okay, so whenever the heart contracts and relax, or systole and diastole, that is called as one cardiac cycle. Okay, so whenever the heart contracts and relax for one time, that is called as the one cardiac cycle, or systole and diastole, that is called as one cardiac cycle. Stages of cardiac cycle. The normal number of cardiac cycles per minute ranges from 60 to 80. So in each minute, there will be around 60 to 80 times the heartbeat. That is, one heart cycle is systole and diastole, contraction and relaxation. So this happens for almost 60 to 80 times per minute. 80 times per minute. In case of newborns and small children, it will be much more, almost 120 times. But in case of adult, it ranges between the 60 to 80. So heart beats almost 60 to 80 times per minute. So this is called as the cardiac cycle. Each cycle lasts almost 0.8 second, because if it is 60, then almost 1 second, and if it beats 80 times, so it is less than 1 second, 0.8 second. And consists of the this each cardiac cycle consists of the arterial systole, ventricular systole, and complete cardiac diastole. Okay, so these are the three stages. Actually, if you go into much more detail, but if you know even systole and diastole, it is more than enough. Now coming to the vessels, what exactly you mean by blood vessels? Okay, so blood vessels are divided into three types: the arteries, veins, and capillaries. There are three types: arteries, veins, and capillaries. Arteries will carry the oxygenated blood most of the time. Okay, so the artery vessels that carry blood away from the heart. So usually it will carry the blood away from the heart. Usually, as I said, usually it carries oxygen, not always, but usually it carries oxygenated blood. All arteries carry oxygenated blood except the pulmonary arteries. As we have already seen, the pulmonary artery will be carrying the, so this is the pulmonary artery which is carrying the deoxygenated blood. Except this artery, pulmonary trunk and pulmonary arteries, all other arteries carry the oxygenated blood. So this is also artery, this is also artery, but this is only artery in the body which is carrying the deoxygenated blood, impure blood. Okay. Then coming to the veins and venules, arteries are the large arteries, arterioles are small arteries. Veins are the large veins and venules are the small veins. Veins, vessels that carry blood towards the heart. Usually, all the veins carry the blood towards the heart. Usually carry deoxygenated blood, impure blood. Okay. All veins carry the deoxygenated blood except the pulmonary veins, as we saw before. So the superior vena cava, the inferior vena cava, all will be bringing the blood, carrying the impure blood. If you see the previous pictures, it was shown in blue color, right? So this is the superior vena cava, inferior vena carry, and all other veins carry the deoxygenated blood, except the pulmonary veins, which are carrying the blood from the lungs back into the heart. Only these veins, two veins, carry the oxygenated blood. If not, all other veins carry the deoxygenated impure blood. Okay, so that is the difference you should remember. Okay, so veins usually carry deoxygenated blood and arteries usually carry deoxygenated blood. Exceptions are there. Okay, then coming to the capillaries. What are capillaries then? So the connection between the arteries, the smallest artery and the smallest vein, that is the arterioles and venules, those are called as capillaries. Capillaries, the smallest blood vessels that connect the ends of the arteries and beginning of the veins. So the connection between the artery and the vein is by the capillaries. So now if you study the structure through the histology, so this is the structure of the artery and this is the structure of the vein. The arteries have a thicker wall and the veins have a thin wall compared to the arteries. The arteries will have a circular lumen, but the veins have a collapsed lumen unless there is blood in them. If not, they are usually collapsed. There are much more details. We will not go into much of this detail. Okay. So now coming to here, if you see here, this is the artery and this is the vein. The artery has a thick wall, the vein has a thin wall. And between the arteries and the veins, these are called as capillaries. Connection between the arteries, the blood is pumped from the arteries into the smaller arteries. These are arterioles, and here is the capillary bed. From there, the venous blood will go back into the veins. So the smallest arterioles break up into number of minute vessels called as capillaries. So our smallest arterioles break up into small vessels called as capillaries. Capillary is small blood vessel that allow diffusion of gases. This is the place where there is diffusion of gases and nutrition. So from here, all the blood vessels will give the oxygen to the cells and remove the carbon dioxide, supply the nutrition and remove the all the waste material. So this is the place, capillary bed is the small blood vessel that allow diffusion of gases. Diffusion means exchange of gases, nutritions and waste between the plasma and the interstitial fluid, between the cells and the this blood. Okay. The capillary walls consist of a single layer of endothelial cell. If you study this, it is lined by, these vessels are very thin, lined by a single layer of endothelial cells. There is no thick wall like this, no thick wall like this, just endothelial cells. The capillary form a vast network of tiny vessels which link the smallest arteriole to the smallest venule. As I said, the smallest arterioles will be connected to the smallest venules by this capillary bed called as the capillaries. So this is how the blood flows. From the heart, it is pushed into the arteries. From the arteries, it will go to large arteries, medial sized arteries, small arteries. Then it goes to arterioles. From there, it goes into the capillaries. From capillaries, it begins as the venules, small veins, medium-sized veins, large veins, and back into the heart. This is how the blood will be flowing. Here, there will be oxygenated blood. Once it reaches the capillaries, it will become venous blood back into the heart for oxygenation. So this is whole cardiac cycle and the circulatory cycle. Apart from the arteries and veins of different parts of the body, the heart itself needs arteries and veins. These are called as coronary arteries and coronary veins. The the supply oxygenated oxygen for the heart itself is by the coronary arteries supply the heart wall with the oxygenated blood, and the cardiac veins will drain or remove the deoxygenated blood from the heart wall. So these arteries and veins will supply the heart itself. So this is all about this lecture called as the cardiovascular system. Okay. So if you have any doubts regarding this lecture, you can ask me now. Do you have any questions? Okay. So if you don't have any questions, okay, we'll stop here. Thank you very much.